Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
With me in the studio today is Dr. Uwe Reuter, a specialist on pain management from the Charité here in Berlin. Hello, and welcome to the show. Dr. Reuter, nearly everybody has taken some painkillers in their life for smaller pain or acute pain. But when are painkillers simply not enough?
Painkillers are not enough when they don't take away the pain. When patients have to increase the number of tablets to get rid of the pain, and when the pain recurs and becomes a chronic daily pain.
And there can even be some kind of adverse effects, like that painkillers intensify the pain by themselves.
Yes, that's possible. That's what I was talking about. If you need to increase the number of tablets to get pain relief, then there's a chance that everything reverts and the painkillers can cause pain at some point.
And the solution is just simply discontinue the painkillers? Or what's the solution for that?
That's one probable solution, but there are other solutions which are multimodular treatment of the pain.
Okay, so there's acute pain and there's something like chronic pain. So what does a specialist say? When does pain become chronic?
Pain becomes chronic when it persists for more than 3 months.
More than 3 months? Then you say it's a chronic pain.
Yes.
And sometimes the cause of the pain has vanished, like in a slipped disc. The disc slipped back, but the pain is still there. How can I come to this?
We have a pain memory. You can learn pain like you learn how to calculate in school. And as soon as our brain knows, as soon as the nerve cells have learned, then it's much easier for them to generate pain.
So there's no cause at all, but this pain is going on. And the treatment for that, pills?
No, not only pills. Pills are one consistent element or one necessary element for treatment, but other treatments like psychological treatment, seeing a psychiatrist, and other treatments are very helpful.
As we saw in the report from the multi-modular pain management thing.
Yes, exactly.
So and there are different specialties working together. So why is this necessary, that different doctors work together?
Pain is not a single disorder. Pain is associated with many other disorders like anxiety or depression. And pain is also very much dependent on emotions. So you need a specialist on emotions, a psychologist, to see and to analyze all other disorders that help to contribute to generate pain.
And the psychologist, does he just help the patient in coping with the pain, to getting coping strategies, or does the psychologist really reduce the level of the pain?
Psychologists help to cope, but moreover, they help to analyze the causes for pain, and by doing so, also to reduce the pain.
In my office, I sometimes see patients who get depressed when they are in constant pain and chronic pain. But sometimes depressed patients are getting pain. So the depression can cause pain and the pain can cause depression. It's like a vicious circle. How can you distinguish what comes first?
Very often you cannot distinguish what comes first. We know that depression can cause pain and pain can also cause depression. We know from neuroimaging studies that pain and depression both activate the same structures in the brain.
And if I got a patient with a depression and a pain, he's a sure candidate for the multimodal pain management?
Definitely.
Okay. What can the patient expect from this approach?
The patient, no, patients usually do not become pain-free, but patients can expect a significant reduction, a more than 30% reduction of pain intensity and frequency.
Many patients worldwide suffer from chronic headache or migraine. What can you expect from medication therapy?
Acute medication therapy is usually not very helpful in chronic headaches. In chronic headaches, you need preventative therapy, and the preventatives we use are antidepressants, antiepileptics, or other substance classes.
On migraines, like beta blockers that just get rid of all those migraine attacks.
Absolutely right.
Is it easier to treat headaches preventively, like back pain?
Yes, it's easier to treat headaches preventively.
Okay. Doctors sometimes prescribe medication which are not painkillers, but who dissociate the patient from the pain. What do doctors mean by dissociation from pain?
That's a very common approach. And what the drugs do is they lay a cloud around the pain centers in the brain and protect the pain centers in the brain from generating new pain.
And what kind of patients would you prescribe those kind of pills?
In patients with chronic headaches, meaning patients with more than 10 days headaches per month.
And patients can't get addicted to them?
No, from these pain distancing drugs you cannot get dependent.
What else would you advise patients with chronic pain, just apart from painkillers and those dissociation drugs?
It's absolutely necessary, in addition to painkillers or preventative drugs, to do psychological treatments like muscle relaxation or autogenic training or acupuncture, for example.
Does acupuncture help in chronic pain?
Acupuncture helps in chronic tension type headache, but in chronic migraine, acupuncture is as good as sham acupuncture, meaning when you prick the needles, not in the acupuncture spots, but in spots next to them.
Well, that's surprising, isn't it?
Yeah, it's a bit surprising.
Can you just ignore chronic pain? Like say, okay, I will just continue with my life, I don't think about the pain. Does it get worse or does it get better?
No, you should not ignore chronic pain. It's typically getting worse, and you need a multidisciplinary approach to treat chronic pain.
Okay. We got a lot of viewer questions from all over the world. I think pain is a global phenomenon. So let me just ask you some questions of our viewers. Myrte van der Loo from Thailand. She's got a migraine, and the migraine doesn't get better from pills. What should Myrte do?
So, difficult question to answer from the distance, but we need to know whether acute pain doesn't disappear or whether she has got chronic pain, how many tablets she takes per day or per month. Maybe it's medication overuse headaches because she takes tablets on a daily basis.
So this is one of those things where you could just try to discontinue the medication and see if it gets better?
Yes.
Okay. We got a question from the Lebanon. Madia Abida Malouf from Lebanon. Her child has headaches after coming home from school. What do you think about that?
Headaches in children is more common than we usually think. We need to check out whether the school day is too stressful for the child, whether the child has enough time to play in between classes. We need to analyze this, and then there's probably a solution for the child.
And sometimes some visual problems might lead to headaches as well, so the child just needs glasses.
Yes, that's also very common in very young children.
And this kind of a tension headache then, or?
Yeah, it's more a tension headache. Yeah.
Okay. Let's go to back pain. Ye Tseng from China wants to know what's the best exercise training for back pain?
It's probably a muscle relaxation therapy, Jacob's method, or autogenic training.
Okay. Alex Chavacanti Martins from Brazil dislocated his shoulder in a traffic accident, and he still has a painful shoulder after weeks, especially at night. And his GP wants to prescribe steroids now. Is this the right approach? Steroids
help to relieve pain, but you shouldn't take steroids for longer than 2 or 3 weeks because of adverse events.
Okay. And Esther Andresen from New Zealand has head and neck pain after work. So what kind of relaxation technique is the best?
Difficult to answer. Again, muscle relaxation, Jacobson's method, autogenic training.
Dr. Reuter, thanks so much for being in the studio. Thank you.
You're welcome.